Post-operative instructions, dental implants. This video will cover important information regarding proper post-surgical care for dental implants. It is imperative that you follow the instructions carefully to maximize your healing and improve the long-term outcome of your dental implant surgery. Do not disturb the wound. Avoid spitting or touching the wound for a few days after surgery. There may be a metal stump protruding slightly through the gum tissue. Some mild bleeding or oozing is normal for 24 hours. You can control excessive bleeding, where your mouth fills up rapidly with blood, by biting on a gauze pad placed directly on the bleeding wound for 30 to 45 minutes. If bleeding continues, please call the office for further instructions. Swelling is a normal occurrence after surgery. To minimize swelling, apply an ice pack or plastic bag or towel filled with ice on the cheek in the area of surgery. Apply the ice off and on as much as possible for the first 36 hours. Drink plenty of fluids. Avoid hot liquids or foods. Soft foods and liquids can be consumed on the day of surgery. You may gradually return to a normal diet as tolerated 3 to 5 days after surgery, unless otherwise directed. Warm saltwater rinses can be made by mixing a half teaspoon of salt in a cup of warm water and should be used at least 3 to 4 times a day, especially after meals. If you were given a prescription mouth rinse, such as PerioGard, use it as directed in addition to the salt water. Brushing your teeth is important to decrease the risk of infection. Be very careful with brushing around surgical sites until the gum tissue is fully healed. Keep physical activities to a minimum for several days following surgery. Avoid bending over, heavy lifting, or strain. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise.